So welcome to the Nocturnal Fitting Guide. In this video we're going to talk about long-term wear and correction of presbyopia with nocturnal night lenses. I'm Scott Brown, optometrist at Scotlens. So if we consider the fact that patients get this fantastic freedom from contact lenses and spectacles, the lifestyle benefits are worth okay. And the fact that they're not wearing a contact lens during the day means that if they have any dry eye issues, that can be managed with normal process. It means that we end up with a mode of wear that, although yes, it's fantastic for kids and for myopia management, actually in my practice, the majority of patients are over 18, and it's because of the lifestyle benefits that they get. And that, of course, means that we want to know about the long-term wearers that we see, because these patients are effectively going to be wearing the lenses for their entire lives. So first of all, looking at the cornea. So this image on the left, so this is a non-contact lens wearer, and this is a cornea from 2007 and 2021, and we're doing a comparison. So you can see that the baseline comparison, 14 years apart, the cornea is exactly the same, and that's what we would expect. So this is why when we do start patients off with nocturnal, we want to make sure we get a really good baseline measurement, because the corneas are not going to change throughout life. In this example on the right, we've got a patient who's been wearing the same nocturnal correction for 11 years, and you can see the same lens is giving the same results, so there's no difference between the cornea, this post-wear cornea, even after 11 years of wear, the patient needs the same correction. And interestingly, if we take somebody out of wear, what does their cornea do? Well, it returns back to the baseline measurements. So here we've got a wearer who is gone into a monovision correction, which we'll talk about in a second, but we've got their baseline. We've got them wearing lenses for, well, you can see them at the 10-year point, and then after 11 years where they've discontinued, they've gone back to the baseline corneal measurements. So again, we get that return to baseline. So ortho-K isn't changing the cornea, it's just changing the epithelial cells. Of course, the structural shape of the cornea comes from the stroma. So that's why we get this return to baseline. Something that we can see, especially, and this is why we provide you with the wetting drops or the starter kit, is we can see solution reactions and patients can develop solution toxicities. This usually manifests itself as a drop in vision, and then you start to see staining where the lens wouldn't be causing staining. So we can see it on the conjunctiva, or we can see it in the peripheral cornea. And this means that the patient needs to just switch to a preservative-free mode of wear, and preservative-free is generally best for long-term wear with patients. Of course, if we've got patients aging whilst they're wearing the lenses, we're going to come across presbyopia. Now, with ortho-K, we get this distance center multifocal cornea, and that's why it works with the myopia management, but it also can help in presbyopia. So here we've got a case where we're looking at, effectively, a patient's got bilateral multifocal corneas as a result of the correction. So patients tend to get a much softer introduction into presbyopia, where they for years feel the need to top up their vision a little bit in certain conditions, but it's not enough to actually warrant doing anything about it. So we're providing patients to start with distance vision correction with both eyes. But the other options that we've got, well, we can look at patients maintaining this distance vision correction and going for reading glasses over the top, particularly if they've got an interest, a lifestyle benefit, golf or sports. Another option is to undercorrect bilaterally, with providing patients with a minus prescription to enhance the distance vision for night driving and those kind of things. And that can be often an option for early presbyopes who are still able to have accommodation and can still read reasonably well. And then as presbyopia develops, to give patients flexibility, we can go into a modified monovision strategy, providing glasses for distance over the top. I usually advise patients that they're always going to need glasses for distance over the top. This, of course, is a particularly useful strategy, the monovision strategy, as things are just now with intraocular lens replacement. So if patients start to develop cataract, if they know that they're used to a monovision balance, it means they can transition into a similar correction with IOLs. Now, some practitioners choose to fit a smaller optic zone to try and enhance the presbyopic effect of bringing in the eye sooner. My own preference is to keep patients seeing as good quality as they can, just fitting with the standard optical that we supply. But you can choose to fit a smaller optical correction if you so choose. Just to finish off, for kids of all ages, if we look at this patient, so this is an 81-year-old male who's been wearing Nocturnals for 17 years. His main motivation is golf, so he goes for a distance correction and he wears reading glasses as and when it's required. But if we consider the fact that this patient has no contact lens discomfort, if they have any dry eye, they can manage it, which he doesn't need to do anything over and above. It means that for kids that we're fitting now, age 10, potentially they could still be wearing this contact lens correction 70 years later, which is it's one of the few modes of wear that I'd have confidence in being able to suggest that to patients. So thanks for watching the video. Keep watching the other videos in the series. If you've got any further questions, you can email lab@scotlens.com. And thanks for watching.